Women don't panic about their hair loss because they're weak, but they panic because they notice it earlier and feel it deeper, and rarely given clear medical explanation about their hair loss. Today I want to explain why hair loss affects women so differently and what treatments actually help them. Myself, Dr. Samiksha Tyagi, plastic and hair transplant surgeon from Noida. I see women with hair loss every single day. Students, working professional, mother, elderly ladies and everyone. And the panic I see is not imaginary. It comes from confusion, fear, lack of correct guidance. Hair is not just hair for women. It is tied to their identity, their confidence, femininity and self-image. When a woman notices hair thinning, it doesn't feel cosmetic, it feels personal to them. Most often, in men, hair loss is in visible patterns, but in women, they lose hair silently, and silence creates more anxiety. Here is one important truth. Women usually detect their hair loss earlier than men. They notice widening of the parting, thinning of ponytail, more hair on their pillows, less volume when they are styling their hairs. Men often notice hair loss when they develop bald patches and it appears gradually. So, it's not that women are overthinking. They are just observing their process, and that too in early phase. One of the most frustrating things women hear is that your reports are normal. So what is the logic why you are shedding hair? It's not true. But you should understand that hair loss is not always seen in your blood test. Mild deficiencies, hormonal fluctuations, stress, nutritional imbalance can still cause significant hair loss. When symptoms are dismissed, then the panic increases. In women, in ladies, the female hair loss is rarely caused by just one factor. Most of the time, the common triggers include multiple causes like stress and emotional overload, post-pregnancy or postpartum hair loss, PCOD changes, thyroid imbalance, iron or protein deficiency, hair loss after the crash dieting, or postmenopausal hair loss. There are multiple causes which are acting simultaneously to cause hair loss in ladies. Let's see all of these causes one by one. The first one is stress and emotional overload. The stress can be physical stress or emotional stress, both. Body naturally increases cortisol level as a part of their increased stress, which we call fight or flight response. And this hormone affects your whole body and simultaneously it is affecting your hairs. That's why your hairs from growing phase go to resting phase, and that's why after few days to weeks to months you see you are shedding more hairs. The next common cause is pregnancy hair loss. It is a very common condition that usually occurs after 3 months of childbirth and can last up to 6 months or so. It is a normal part of pregnancy and it's usually temporary. And shedding should last less than 6 months. And most of the ladies gain their normal volume when your child turns 1 year old. And it happens because of the estrogen levels which increases during pregnancy time. That time you are not shedding your hair, you notice that your hairs are fuller, and immediately after pregnancy, when the estrogen levels come down, after few weeks to months, you start shedding your hairs. The next common cause is PCOD. It happens because of multiple hormones like testosterone, estrogen, FSH, LH, insulin. You need not know these names as well, but these are all affecting your hairs. Similarly, next important cause is thyroid imbalance. Low thyroid level or high thyroid level both can cause hair loss. Another common cause is iron or protein deficiency. It's very common and medically it has been shown that these kind of deficiency leads to thinning hair and decreased hair volume. One important thing in ladies is crash dieting. All kind of crash diet and losing weight suddenly hampers your hairs. The most common cause is postmenopausal hair thinning, and though it is a part of natural aging, it's because it is causing decrease in estrogen level, which affects your hair health, and gradually you see thinning out of your hairs. Similarly, with aging, there is some amount of thinning. So both the things together They give you appearance of much finer hair, and sometimes you lose hairs in excessive amount. But good thing to know about this, many of these causes are reversible, but only if you identify them early. Now let's see what are the biggest mistake most women do, and these are very important. Here is the biggest mistake I see. Women stop treatment in few weeks to months, and they do not wait for hair treatment to show results. Women many a times copy their treatment from their husband or brother or someone like that, which will not help them. Similarly, internet remedies which are done without supervision also affects your scalp health. Or sometimes just delaying the treatment in the hope that hair loss will stop again takes your important time, and then you see less result after the medical treatment. Let me see this clearly. Most female hair loss are manageable. Many cases are fully or partially reversible. During our practice, we have seen that proper diagnosis at early stage will bring back your lost hair, improve your density, and cover thinning areas. Ladies respond very well with medical treatment, that too without any intervention, but make sure that you continue your treatment for 6 to 8 months. Early intervention makes massive difference, but panic does not. Understanding is very important. If you are a woman experiencing hair loss, here is what you should know. Do not self-diagnose. Do not you compare yourself to others, or do not wait till bald patches appear. Seek proper evaluation early. Hair loss in women is not a failure, it is just a signal. Women panic about their hair loss because it's not because they are emotional, but because they are more observant. Hair loss deserves clarity and not fear. If you want science-based honest hair guidance, subscribe to this channel.